Welcome to the final installment of our Launching WorkRise event series. I'm Stephanie Davidson, Program Officer with the Kresge Foundation's Human Services Program. Before I introduce our panel, a few housekeeping notes. This event is being recorded. The recording will be posted on the WorkRise website afterwards. All attendees are muted, but we encourage you to submit comments or questions to the Q&A box at any time. Detailed speaker biographies are available on the WorkRise website. You can share your thoughts on social media using the hashtag WorkRise. For those of you just joining the conversation, WorkRise is a new national platform for identifying, testing, and scaling bold ideas for transforming the low-wage workforce. WorkRise is also elevating existing knowledge across often siloed groups, creating a shared space for employers, labor leaders and organizers, researchers, practitioners, and policymakers to learn from one another. We're spending this week exploring the key mechanisms that shape opportunity and economic mobility for workers, and new ideas and solutions that can accelerate both. Today, our focus is on taking a 360-degree view of workers and the supports they need to succeed in the labor market. As we all know, workers are so much more than their jobs. I know I'm more than my job. We as workers are parents, caregivers, and community members. Solutions that support economic mobility can't simply focus on jobs and wages. They must take a human-centered, holistic view of workers and their roles in families and communities. So many factors must be in place to help workers succeed in the world of work, starting with the basic necessities, the ability to put food on the table, to live in safe, affordable housing, to access quality, affordable childcare, and to seek medical care when they are sick. Add to that reliable transportation to and from work, the ability to build savings and wealth to buy a home, pay for college, retire, or weather economic shocks, whether they're big shocks like COVID-19 or simply a flat tire on your car. This doesn't even account for family vacations, going to the movies, and other things that may be out of reach for so many. And now, massive unemployment caused by COVID-19 has again highlighted and worsened gaps, racial inequity gaps in our labor market, and exposed gaps in the public system of support. Joining me today are a group of speakers who spent their careers studying and engaging in these issues. Speakers, as I introduce you, please turn on your cameras. First, we have Marla Blow. Marla is Senior Vice President of Social Impact for North America at the MasterCard Center for Inclusive Growth. Hi, Marla.
Hi there.
Next, hey. Next, we have Tracy Waring-Evans. Tracy is the President and CEO of the American Public Human Services Association. Hey, Tracy.
Hi.
Next, we have Julia Henley. Julia is a professor at the University of Chicago School of Social Service Administration. Hi, Julia.
Hello.
Hey. And finally, we have Sharon Parrott. Sharon is Senior Vice President for Federal Policy and Program Development at the Center for Budget and Policy Priorities. Every time CVPP gets me. Hey, Sharon.
Hi, everybody.
Now that we're all on, I'm going to start with you, Sharon, with a long first question. Are you ready? Okay. Even before the pandemic, millions of families were struggling to make it. And now the pandemic has caused millions of workers to lose jobs and incomes. Many are seeking assistance to meet a variety of needs. While programs that provide financial and other supports for families have taken steps to be responsive, what longer-term policy solutions are needed for workers as we rebuild the economy? And how might these programs be built to support families for the long term, not just the immediate crisis?
Thanks. So one of the things that the current crisis has really done is make clear how weak our supports for workers are. This is, of course, not new news to low-paid workers themselves, but the crisis has made it more broadly understood. Currently, low-paid workers not only contend with low earnings, but also with an unemployment insurance system that often provides no protection for them at all when they lose their jobs because of restrictive eligibility rules. And if they do qualify, the benefits are very low. And that means that even a temporary stint of unemployment can create an immediate financial crisis for the household. When low-paid workers are working, when they do have jobs, they frequently don't earn enough to afford childcare. They often don't have access to paid leave for both short-term illnesses and for those longer-term illnesses or caregiving responsibilities. And high-quality, stable childcare is often out of reach, with only 1 in 6 children who needs help paying for childcare actually getting it. Now, the fact that our worker support system is so weak is what sent policymakers out with duct tape and string to try to piece together some immediate worker support systems in the early relief packages. But building it on the fly both creates problems and doesn't create a lasting solution. But there is good news here. I think we actually know how to fix this. We know we can provide childcare subsidies to workers, and we know that when we do, it matters. We know that other countries have far more robust unemployment insurance systems that do protect more workers. We know from programs around the country that we can raise the minimum wage and that we can offer paid leave through a variety of mechanisms. And so we know a lot about what to do, and really the question is, will we find the will to make those longer term advances in policy?
Thank you. It really feels like it's a bridging of so much together. Let's turn to Tracy now and think about, for low-wage workers, public supports focused on economic security really can be a lifeline when a job ends or hours are cut, or right now when you just simply can't work. So how do you see the relationship between these economic support programs and work?
Well, thanks, Stephanie. And let me start by congratulating the WorkRise team for their official kickoff this week. It's a pleasure and really a privilege to be with all of you today to talk about these really important perspectives as we think about the 360 way all of us really, interact in our work and our families. And to your question, Stephanie, I think when we step back, I think it's true for all of us, right? That having access to economic and social supports is foundational to being able to weather life's inevitable ups and downs, whether that's job loss, personal or family illness, or other life circumstances. And, really amplified, as Sharon just noted, for workers with low wages. And I think, a key aspect is to say that they're inextricably linked to work, right? So how we interact, you cannot separate, especially for workers with low wages. And I think, as you noted at the beginning, Stephanie, many workers are parents, which means they have that dual role as breadwinners and caregivers. And our public supports, whether it's nutrition, childcare and housing subsidies, income supports, we really have to see them as a critical part of our community infrastructure. They're core. They help stabilize families in challenging times. I just recently heard a young parent say, it removes one of my worries when I have support to pay my rent, or one of my worries when I am able to put food on the table for my kids, and ensuring that access to quality childcare and healthcare, and employment-specific supports themselves, right, or access to resources to get that new skill or train in new areas that really can help succeed and have economic mobility in the long run. So I'll just say that I think we often consider them to be binary choices. It's public economic or social supports or some sort of employment and work supports. And the truth is that they're linked together. They're building blocks. They're part of a continuum to social and economic mobility. And we've got to understand them in the local context of also where people live and where their communities are and what they've experienced and what the history is there. You spoke certainly about the efforts to center on equity. We do ourselves a disfavor to workers when we place kind of artificial limitations that don't account for that important context. And in order to really center equity in our work, we know we've got a lot to do as a nation to lay new tracks, if you will, to connect workers that have been routinely and systemically disconnected from education and employment opportunities.
Thanks, Tracy. I think what you're laying out is so important to not just think about security, but mobility together to advance families. And I'm glad you brought up parents. So I'm going to shift this over to Julia. When thinking about parents, there's really this conflict between the trade-off of work and family caregiving. And without greater investments in childcare, many workers are losing their footing in the labor market. We're seeing this play out right now with more mothers are quitting their jobs to stay home with children, to supervise schooling. I was in a meeting this morning where someone was teaching 4th grade algebra while we were trying to do work. I can't imagine. But what policies could support workers, particularly women and people of color, whose careers have been disrupted or halted due to caregiving?
Yeah, thank you for that question. So I guess the first thing I would say is that the misalignment of paid work and caregiving has been with us since long before COVID, but the pandemic, like it's done for so many issues, has put the conflict between work and family spheres in really stark relief. So as was true before the pandemic, I would argue that the work care trade-offs that are so painfully familiar to parents, especially mothers and people of color, they won't be rectified without broader changes, improving the quality of jobs on the one hand, and without significant public investment in comprehensive caregiving supports on the other hand. I think we'll have time to talk about what those changes might look like later in the webinar, so let me more narrowly focus here on your question about policies that could best support parents, particularly women and people of color, who have been disproportionately affected by the pandemic. So I guess I would focus in a few places, and I'm guessing none of this will sound unfamiliar, but you know, first of all, I think there's a lot we could do immediately to address disruptions due to new caregiving demands of COVID. We could pass an economic recovery package, a stimulus bill that both continues and expands supports for parents and other caregivers who are facing disruptions to work, either who have lost jobs or cut back hours, and who are grappling with increased caregiving responsibilities for their young kids and school-age children due to remote learning. This would include things like strengthening mandates around emergency paid sick time, extending and expanding emergency paid family leave, expanding unemployment benefits, especially to cover disruptions in work due to childcare and elder care needs, and increasing the availability of cash assistance, SNAP, and other emergency relief to households affected by the pandemic, many of whom may not qualify for UI benefits. We also need to stabilize the childcare industry to keep programs solvent and to further invest in our childcare infrastructure across all sectors, home-based and center-based care, to better serve families and the childcare workforce during the pandemic. So this would mean that we need to realize that childcare programs can't just bounce back once they've shut down, that there's a lot of concern about closures becoming permanent given our already fragile childcare infrastructure. We need to provide relief to providers who are closed, including helping them support staff who may be laid off. And we also need to provide supports to closed providers to help them reopen. And finally, we need to offer resources to those providers who have been able to remain open so that they can safely offer services and provide support for their staff and their children and families in their care. So these are all pandemic era supports that I think are all really necessary. I hope that later we'll have a time to talk about what I see as more permanent investment needs to address the long-standing conflicts facing working parents.
Thanks. I think it's so important to highlight that so many families were struggling before the pandemic, and this is just really showing what a lot of us already knew. So we've been talking a lot about public support. I want to shift over to talk about employers a little bit. So Marla, I'll give you this three-part question. What responsibility do employers have in ensuring workers have the family supports they need to succeed in the job? What are the challenges employers face in extending these supports and benefits to workers with low income? And how could these challenges be overcome? And then finally, what about the folks that are piecing together full-time work from a scattering of full-time jobs or working as contractors?
Absolutely. Great questions all. And you know, I will even broaden out on that, right? Because we have to think more broadly than employers. And employers certainly have a role to play in this. But this is a question that the public sector, our social sector, the private sector, all have to tackle together. That working in unison and in coordination, we have an opportunity to really make some game-changing moves here. With COVID-19, we've seen massive unemployment, right? We've seen, prior to COVID-19, we saw a growing gig and freelance economy that's grown by 15% over the last 10 years, right? And the recovery from the Great Recession also saw growth in low-wage jobs that are much less likely to provide benefits. And so this really points to the need to rethink and really revisit the concept of an employer-focused model for providing benefits. It creates so many gaps, so many opportunities for loss of benefits, for loss of critical support, and in instances like what we're facing right now during a pandemic, the loss of that critical support in exactly the wrong time not to have things like healthcare, for example. So here at the Center for Inclusive Growth, what we've been looking at is how we can engage and drive thought leadership and build some narratives around this. We've partnered with Benefits 21 in partnership with the Aspen Institute, where we're thinking about the full suite of public and private benefits that workers need, from basic income support, short-term, long-term savings, paid sick leave, all components of making those wheels go around. We've begun to develop a framework for building and delivering an integrated system of benefits that's inclusive of all workers, portable to prevent interruption due to job loss, people-centric to prioritize the experience of those who need it to work, and interoperable across technology systems. And those components and dimensions of a system of benefits really creates the confidence, the security that workers need to be able to navigate this ever more complex labor market that they're facing. So I think we have to flip that question around a little bit, right? And build around workers and their families, and then determine which actors are best placed to provide those benefits, whether that's the employer, like you said, or the public sector, or some combination of all of what we've talked about here.
Thanks. With that in mind and think about responsibility, I'm going to go off script a little bit and shift and ask Sharon a question building on that. So Sharon, could you tell us about the role of employers versus public systems in providing supports, and how should we be thinking about responsibility in this relationship?
Yeah, great, thanks. So Marla's exactly right that if we decide that we want low-paid workers, right, to have access to a set of supports, there is this question of then, like, where are they properly situated? And that's one question of who provides, and then there's another set of questions about who finances, and how does the financing system work. You know, I think as we think about what should be an employer responsibility and what's a public program responsibility in terms of delivery, there are this sort of I think there are different things to think about. You know, I think in the United States at this point, it's likely to be some combination of employer and public programs. We're probably not going to shift all benefits to public programs, though we could have an interesting conversation about whether that would, if we were starting all over again, I think, you know, where would we land on some of those questions? You know, one way to think about how to parse out who should be providing and financing is to, one thing to think about is what are the benefits that are expensive and where costs vary systematically across workers in ways that could lead to pretty significant incentives for employers to discriminate against those characteristics. So let's take child care, for example, right? Who's more likely to have child care costs? Families with children, parents, and possibly women. And so, and particularly single parents, right, where the cost may not be shared. So it seems pretty clear that that's a case where you want the benefit not to be provided, at least as a broad matter, not as a broad matter, a public program is likely to be better situated, particularly for low-paid workers who often change jobs multiple times, and you don't want their childcare arrangements changing, and we don't want to set up a structure where employers have a disincentive to hire parents. In healthcare, we obviously have a hybrid model at the moment, right? So many employers provide coverage. There is a weekly or maybe not even at all enforced employer mandate in the Affordable Care Act. But there are lots of people who don't have access to health coverage that is affordable and comprehensive, particularly for family coverage through their employers. And lots of people think that as we think about how to broaden coverage, one thing we're going to have to think about is how to broaden access to coverage outside of employer-based coverage. Unpaid leave, one might think of a bit of a hybrid approach. For really short periods of leave, for temporary illnesses or vacation or annual leave, that seems has a long history of being provided by an employer and seems sort of right-sized and wouldn't vary super systematically, at least across workers. But when you think about paid family and medical leave for more significant health conditions or for caregiving, that's something that could vary quite systematically. And we've seen that states that have gone to paid leave go to a public system. Employers may help finance, but eligibility and benefits are provided through a public program that socializes those costs. So those are some things to think about when you're thinking about sort of how those benefits are provided and financed.
Thanks. So Sharon, I think I heard you mention childcare, healthcare, and paid leave. Marla, are there other programs or other benefits that you're thinking of when you think about the package for workers that maybe aren't attached to employer but could be public benefits?
So one of the things that we've been thinking a lot about is what's going on with savings, right? And the ability to build savings support and savings contributions have often been tied to employers, although oftentimes that is an instance where that's offered by relatively high-end employment, right? That can be a benefit that's not attainable by all. But looking for some opportunities to create savings aspects and fostering savings and maybe building savings into the employment space is another place where I think both employers and, again, the public sector can play a role in helping drive some incentives around savings. And we've done that through the tax code in times past. We've done that with specific kinds of financial instruments that may have enabled it. So I think there are some places where other kinds of benefits might play a role and might come into play that are really powerful and really important.
Yeah, thank you. That savings piece is so critical and who really has access to financial services. So let's turn a little bit, still thinking about employer role, but of some of the non-monetary pieces. And I'm going to give this question to Julia. Thinking about, say, predictable scheduling, giving workers greater control of their schedules, what do we know about the impact of scheduling and other potentially non-monetary benefits that employers could provide that would really help workers and their families out?
Yeah. So, right, quality jobs that support both economic and caregiving needs of families aren't just about earnings, although adequate earnings are really important. And for hourly workers in particular, I think the first thing I would say is it's important to think about earnings as a function of both wages and hours. And so it is really important to think about whether workers are getting sufficient hours to earn an adequate living, whatever their wage. And then when you turn the conversation and the focus on hours, that then takes us to your question about work schedules, right? So it's not just the number of hours, but also the way those hours get distributed. So a few things. First of all, while non-standard timing jobs, that's where a lot of the attention has been to, jobs that require work during the evening, weekend, and overnight. Those kinds of jobs can sometimes support parents' caregiving efforts. Research suggests that they actually more often complicate them. So the vast majority of formal caregivers, whether licensed family childcare homes or centers, they really don't provide care during non-standard times. And that leaves parents with non-standard hour jobs to rely on informal caregivers, older siblings, tag team parenting arrangements, which sometimes work, but really often don't work very well. in addition to non-standard hours, my colleagues and I have done a lot of work on other forms of work timing challenges. So work schedules that are arranged at the last minute, that involve fluctuating hours, schedules that change week to week, even day to day, or schedules that provide workers limited control over when they work, where they work, or how much they work. Those also provide really complicated conditions for caregiving. And there's considerable evidence that these aspects of work schedules, whether you're talking about non-standard timing or these fluctuating, variable, unpredictable schedules, that they create work-family conflict. They interfere with parenting activities, not just childcare, but the ability to attend a kid's baseball game or to help kids with homework or to participate in mealtime and bedroom routines and kind of the sort of everyday parenting activities that we all know are so important for kids' development and for family life. So this focus on work schedules and job quality more generally, I think of work schedules actually as a dimension of job quality. I think it's a nice reminder that we can't solve the work-family challenges simply through investment in childcare, that there's only so much the childcare sector can do to mitigate problems that are housed often within the labor market itself. So in the last several years, there's been a lot of, I think, really exciting work by work-family scholars, by employers, by policy advocates and legislators aimed at improving the predictability of hourly workers' schedules and compensating employees when they're asked to absorb some of that unpredictability. And some of these initiatives have been voluntary efforts by employers, and work timing and flexible work arrangements are increasingly negotiated as part of collective bargaining agreements, for example. But in addition, several municipalities and one state, Oregon, has passed what are often referred to as fair work week laws or ordinances at the local level. And there's federal legislation as well that's been drafted and discussed. And I'm somewhat hopeful that maybe there'll be movement in another administration to move some of this federal discussion forward. So these policy efforts, I think, are encouraging. There's not a lot of research, but there's some on how kind of effective Fair Work Week legislation is. And I think it at least begins to turn the discussion on some of these non-financial, non-monetary aspects of work that really do matter, I think, for the ability of families to manage their work and caregiving demands. And not just their caregiving demands, but as you said, Stephanie, all the other things we do in life besides just be at home and be at work. We have full lives, and we need to think about how work kind of encompasses all of those pieces of our lives.
Yeah, thanks for that. And so there's one thing that I think we've been dancing around a little bit. We've talked about public assistance programs as an important source of family support for workers with low wages, but we haven't talked about the low wage jobs themselves and how there might be opportunities to improve on those low wage jobs to include better support. So Tracy, could you dive into a little bit thinking about the quality of low wage jobs and how they support families? And I'm going to add a question that isn't on the plan is, could you talk about how human service organizations can partner with employers to strengthen quality of jobs too?
Sure, absolutely. And I think I'm really just going to be amplifying so much of what has already emerged in the discussion. Maybe starting with the point of, as we think about how can we improve the jobs themselves, with the question I think all of us believe in, but sometimes I think we forget to actualize it in our systems, and that is what is it that would make them better by asking people who serve in those positions. And I think that what's happened, during the pandemic has given a little bit more light to the broader public of understanding about what conditions can look like for people with low wage positions as well as opportunities. And I think anyone that goes out and speaks with folks, whether it's the clerk in your grocery store, and ask them about their own experience. I've heard very different things, right? From folks who felt very supported by their employers, who understood their health and welfare at the forefront, versus those who didn't. And there's something in that, I think, that we also need to try to think about as we think about improvement to the positions themselves. You know, I will say, I know we've talked a lot about childcare, but when you think about it from a parent's perspective, there is so much to that. And so I think so many of, as Julia so, you know, well stated, the positions themselves don't always come with the standard work hours or with, you know, understanding about the role that a parent is trying to play. But I think employers are getting much more wise to this. And I'm intrigued by things that have come up. These are not studied yet. This is for WorkRise, I think, to go further and understand. But things like, you know, pop-up childcare that have occurred in safe facilities that are otherwise maybe underutilized, like libraries in communities, and what's in that, and how could that be built more into the fabric of how a community wraps around their families and builds into improvements that might ultimately improve the job quality as well. And then I'll just, I mean, there's a lot of different ways we could go here, but I'll add one other point, which isn't necessarily specific to what you were asking, but it just is, it keeps coming up in my mind. And that's the idea to think about building out more jobs programs that have federal subsidy designed around them, that are designed to ramp up when we have hard economic downturns. You know, when unemployment rates are increasing, and being able to kick in programs that focus on areas where there's a market need, and scale training and education supports quickly to reskill new workers. I mean, these are not new ideas, but the idea that there's triggers, that there's things that we can activate very quickly when there's difficult times, I think those also are really important things for us to keep in mind.
Yeah, thank you for that. So there's something else you said that I want to tease out a little bit more, and it was about talking to workers. Like, we're sitting here on a panel talking about workers, but can you talk about some of the strategies where workers and really families might influence things like public support programs or workforce development programs to shape them to be more successful?
Yeah, I think there's a number of opportunities for that. And I'll just to give one concrete example, you know, talk about young parents or student parents who are in the midst of education or additional education, and the considerations to put in place around that, and how community colleges, and this is, you know, this is already occurring, but wow, could we really scale and amplify it across the country, where they're directly connecting and understanding that probably, you know, up to a quarter of their students are actually parents of young children, and thinking through the connections that they can provide for them, and really hearing from them the moment they walk in the door about what is going to help them be successful as they are, you know, graduating from community college or gaining a, you know, credential in a vocational area. I think, you know, really understanding and broadening that kind of connection that's listening from the very beginning to those student parents who will often say, I don't feel like I'm part of my community, because people don't recognize that part of my everyday being is caring for my children.
Yeah, I remember years ago doing an evaluation of a workforce program that was targeted to young moms, and they couldn't figure out why the moms kept showing up a half hour late for the training. And it's because it was scheduled at the same time as bus pickup. And if you just asked the moms, you could pretty easily fix it. It's amazing, those small things that can make a big difference. But I want to open this up to the whole panel. Do folks have other examples of effective policies or programs for encouraging these types of changes, or places you've seen it in other ways?
So I can jump in a little bit. You know, I think that there is a lot of work happening, particularly in state and local policy, where there is a high level of engagement among organizing groups and groups that represent communities and people with lived experiences of poverty, of racism, of low pay, and a lot of exciting work about how to engage people with those kinds of lived experience, actual community members, right, in the conversation about policy. And so you see that happening in state revenue campaigns where there's an effort to raise state revenues and to create for the purposes of investments, often in things like education and childcare. You see it in minimum wage campaigns. You see it in the successful campaigns around paid leave policies, both mandates that are employer mandates around paid sick leave, for example, as a common one, but also around the efforts that have resulted in statewide or citywide paid family and medical leave longer term programs. That work that work has been really encouraged by a set of foundations, but also I think demanded in rightfully so, that policy be responsive to the needs of people for whom that policy is directed or to whom that policy is directed. And when you see that community engagement, and there are many examples, I'm quite familiar with one in New Mexico, but there are many examples that you see when there is community engagement, when people are asked, to your point about the program that just didn't ask about bus times, right? Or just didn't ask this open-ended question, why? But when people are asked at the front end, not when the policies have all been designed, and then people go and say, don't you want to support this great agenda that I've come up with? When people are asked on the front end, it really changes the conversation and it can change the priorities. But we see that, so I think when we look at successful grassroots efforts around these kinds of issues, around particularly, minimum wage, paid leave, childcare investments, and sometimes the revenues to support them, that engagement by people helping to plot the course for their community is incredibly important.
Thanks for that. And one thing I hear you saying is that we're talking about hyper-local or community-based solutions to a degree, that not necessarily everything's from federal policy, but what happens at the community level. So I want to talk about that a little bit. Like, how do we engage community in designing these programs in really effective ways? Like, there's a lot of mandates. I think of workforce boards have different community entities, but can you guys give some examples of how community has helped design programs? And I guess one other thing I want to point back to is we jump really quickly to solutions without hearing community identify what the real challenges or barriers are. So if you could just dig into how communities can help us identify what the real challenges are for them.
So this doesn't quite answer that question, but I think maybe is a hopeful piece. And that is that, so I'm an academic and I do research that relies on, external funding from foundations and government. And I teach students, and in my case, I teach master's students and public policy students. And I think on both sides, the funding side and the student side, we as researchers are really being pushed in a good way to involve community members in our research. And so, every year, more and more students demand to do community engaged scholarship, demand to do participatory action research that involves community members in figuring out what questions to ask. So before you ever, come up with any hypothesis, there's this real push on the student side. And then increasingly, I would say on the funder side, to engage in collaborations, not just with government policymakers, although I think that's really important as well, but also with community members. So that doesn't answer the question of like how to engage communities in, effective programs. But I think from where I sit, I'm seeing more and more community involvement and community engagement in the work that I do. And I like that, but even if I didn't like it, I would be forced. I mean, it's here. And I think that's really, those are good demands.
Yeah, thanks. Sitting in a funder role myself, we often try to figure out ways that we could actually hear from people on the ground about what works. So I totally resonate with that one. So I'm going to ask the whole panel one quick question, and then we'll get to some audience Q&As. So if you could talk about one policy or program that with the necessary reforms or a bolder vision could make the most impact in supporting workers in the labor market and as parents and caregivers. So one, policy or program, and we will start with Sharon.
Great. I could talk about 25, but I was told I was to talk about one. So, I want to return to this question of unemployment insurance. And part of the reason I want to return to it is that what tends to happen in unemployment insurance is the following. We have a recession. People say, my goodness, that unemployment system is terrible. We do some things to make it a little bit better that work kinda during the recession. The recession's over and everyone's like, I don't want to think about unemployment insurance anymore. And like we're on to other kinds of policy making. And we have seen this quite a number of times. And I think there's a real hope that maybe this time will be different, that the degree to which the system didn't work, the degree to which we needed to try to add onto it, but literally like the systems themselves just weren't set up to do that and to do that quickly, could really spur reform. So what I just want to spend a minute talking about what a reformed system would look like. I think the outline is pretty clear, right? So the first thing is that the rules would either be national or they would have a strong national floor so that people in one state weren't faced with a dramatically weaker unemployment insurance system than people in another state. So that's the first thing. The second is that unemployment benefits themselves would be far more available. So before the pandemic, only about 3 in 10 jobless workers qualify for any unemployment benefits at all at any given point in time. And that was actually pretty steady between after the Great Recession all the way through to the pandemic, 3 in 10. And the reason that people don't qualify are varied, but we often don't give unemployment benefits to people who have to leave a job because of a health issue, because of a domestic violence issue, because of a caregiving need. And so we just don't protect workers for all the reasons that sometimes they have temporary stints of unemployment. So we'd have a system that covered a lot more workers, and when they got benefits, they would be more adequate. The other thing a reform system would do is it would provide enough weeks of coverage of benefits, and that would change when the unemployment rate went up. So that when we were in a recession, we were in a time of labor market weakness, when it was going to take many workers longer to find a job, we would allow greater weeks of benefits. And depending on where you ended up on benefit adequacy, you could add on to benefits automatically during a recession as well. The key point here, right, is that we want workers to actually have access to protection when they have temporary job losses, and we want it to be adequate so that temporary stints of unemployment don't create a crisis. Now, that having been said, there are really complicated design issues, right? Is it a fully national system? Is it still a state system with some better federal standards? And the financing right now, because it is financed by an employer tax, we have literally set up a system with a built-in constituency that's pretty powerful in state capitals that has a vested interest in the system being cheap and not doing much to cover workers. Now, that doesn't mean all employers want a bad unemployment system, but their financial incentive is to have low taxes, to have low employer taxes that finance the system. And so, you know, there are big questions about how big of a reform are we making and how many of those pieces are we changing. But the basic structure of what the system should look like from a worker's perspective, I think there's a fair amount of clarity about.
Yeah, and with that, let's go to Marla next.
Yeah, I really want to build on that. I think Sharon's points are very well taken. And in particular, the patchwork way in which benefits are accessed across this country is a very big contribution to people's underusage of all kinds of benefits. And so what we've seen is intermediaries have sprung up. Intermediaries, some of them quite innovative, like a benefits data trust, for example, right? That enables people to one stop, go in and give their information to one central entity, and then they've built the intelligence that will help figure out what benefits you have access to, centralize the application process, et cetera. But that's been the development of the private / nonprofit kind of sector in order to enable that kind of access. But our governments, both local and federal, can make access much more straightforward, much easier, much clearer. The fact that there are still some benefits that you can only access by going in person to apply, and those offices are open during business hours, during the week, right? There are a whole host of barriers that are, in some cases, I think easily questioned in terms of what the motives are, right? So Sharon suggested that there may be some tension between who is paying for these benefits and their appetite to ensure that those benefits actually are being accessed and used. I think that's exactly spot on, right? And that there's some opportunity to align those interests, either by changing the nature of the source of the funds to back those benefits, or by ensuring that people actually are aware and have easier access to them if we are going to insist that they exist. Another thing that I just want to add to this in terms of how we think about opportunity to make change here is we've also seen, again, some of the places where there's been the most innovation in the private sector suggest some opportunities for change in the arenas where these benefits are being offered. And one that's not really a benefit per se, but that I will draw attention to is our artifact of history, which is the payroll and the 2-week payroll run. That is a function of how difficult it was to cut checks in history. Now, by and large, and I recognize not everybody is covered, but in many instances, money is deposited electronically and can be deposited onto cards if the person doesn't have a bank account. And the fact that we are still operating on a 2-week rolling lag, and we find that people are paying, in some cases, astronomical amounts of money for things like payday loans and other devices that will allow them to bring that pay forward, is just hanging on to something that is no longer really doing work for the market, because most employers can pay much more regularly with much simpler processes around pay administration. And those things can put money back into the pockets of workers. And I'm not here suggesting that should be mandated somehow, or that should be the private sector or the public sector setting some parameters or mandates around it. But I just observe that there are places where we see lots of intervention by young, scrappy upstart startups and some nonprofits that suggests that there is something may not be working, right? And so those are places where I would look if we want to identify where there's opportunity to change this. That's the first place I would go.
Wow. I hadn't thought about, like, we can change people living paycheck to paycheck by just increasing the frequency of how often they're getting paid.
Yeah.
So simple. Okay, so in thinking about the one policy or program, let's just, Tracy, what would you put on there?
Oh, well, first of all, I'd want to double down on what Sharon and Marla just shared. Those are fantastic, and I think really, keys to being able to make some larger systems changes. I'll just speak to one because it's something that is in the human services sphere and is a place that people often connect for public supports, and that's SNAP benefits, receiving nutrition benefits. But there's a SNAP employment and training program that in the human services realm, folks have really been trying to focus more in on and say, well, how could we leverage opportunities to create, greater skill and support families to greater, economic mobility pieces. And it just coincidentally today, we just announced a new partnership that we have at the American Public Human Services Association with the Association of Community College Trustees and the National Community Action Partnership, focused on really building some of that third-party capacity for connecting through training and supportive services that are really connected to what workers need and what employers need, in scaling up what they look like. And I raise that only because it's this cross-systems work. It's this thinking about all of the different pieces that allow any of us to live our lives, bringing education and public sector pieces together, connecting through the place that people often receive services and expanding that, not as a one and done, but that there's a lot we can learn from that and gain from that. And so if we were able to add that to tackling things like benefit cliffs, and assuring that as people move up, they are not having to make those trade-offs that are completely unfair and would challenge any of us in terms of losing subsidies and the like. I think there's some real opportunities.
Great, thank you. And let's go to Julia with one more policy or program.
Okay. So yes to everything everyone has said, and I love the sort of integration of private sector and public sector discussion in responses to this question. I guess my one contribution would be to finally treat caregiving supports as public goods. And so that would mean adopting a comprehensive set of caregiving policies that include things like national paid leave, paid sick time, and other family responsive policies. But also invest in a coordinated and accessible childcare and early education system. So on the childcare front, so this is really a lot of policies, right? But I see this sort of caregiving as public good as sort of a package of policies. On the childcare front, I think a good place to start would be passing something like the Childcare and Working Families Act, which involves really several important changes to the childcare system. It would directly build up supply, including increased investments in public pre-K, full day Head Start and early Head Start, incentivizing existing providers to extend services to hard to reach populations in underserved areas, including non-standard work hours, infant and toddler care for children with special needs. It would involve investing in the childcare workforce. I think we often think about the problem of childcare from the parent's perspective, and that's very real, but we have a very underinvested childcare workforce. So we need expanded training opportunities, increased compensation, improved workplace conditions. And then I think the other pillar to this would be directly supporting parents through making the childcare tax credit refundable, which it isn't, and expanding it, and expanding and improving our childcare subsidy program. I think Sharon mentioned in her opening comments that only 1 in 6 families who are eligible receive childcare subsidy, and we could do a lot better by making that subsidy a guarantee for low-income families, and even have it move up to more moderate income families, so that families don't have to pay more than 7% of their income on childcare expenses. So I think these kinds of public investments in childcare, and I would also say in elder care, I had to narrow, would really take us a long way towards supporting working parents and valuing their labor market contributions as well as their contributions to care.
Yeah, for that. So many pieces to go into there. With that, I'm going to take it to some audience questions. And I want to recognize that we are a moderator and a panel of women, but one of the first questions we got was about childcare. And what about the role of men, and especially fathers, in how they're served within as workers, but as fathers and providing childcare? And I'll leave this open to whoever wants to answer the question.
I'll weigh in. I think first of all, the fact that this is the question that got asked is really an important one, and that so many of our public supports have been designed with a real focus often on mothers and not on fathers, and not on fathers in an inclusive way. And so I think there's there's much we need to do to flip the lens and really make sure it's holistic for parents as a whole, and supportive in that sense. So we could go down many different pieces, but just starting with, are we asking the question, what does this mean for a father? And any policy we're putting in place, I think, has got to be much more embedded in our work than it is today.
Yeah, I agree with that. And Tracy, I thought your sentence was going to go in a different direction, which was that a lot of the policies and practices are built around the assumption that there is someone that is non-working back at the house, right? And that the it is built around fathers, in the sense that the assumption is fathers don't have to play a role, right? And can be free to focus entirely on work because there's someone else, and there's a division of labor that someone else is focused entirely on the home. As we have found, both parents, two partners, both in the working world, that assumption has dramatically changed and been revealed to not be applicable. And yet a lot of our policies, practices, our rules, regulations have not caught up with the fact that that structure does not hold. And so fathers actually have the same needs if there isn't someone at home to backstop. And so I think thus the rethink and a lot of what we're talking about here, because we're still carrying some of the same policies and practices that were developed, in the days of, in the 50s. I won't name any particular, anything else.
And I think we can do a better job of incentivizing leave taking and caregiving for fathers, right? I mean, I think we both locally and in policy, we don't take advantage of. I mean, there's very explicit incentives for leave taking in many Scandinavian countries and other countries, in the way family leave is set up to encourage longer leave taking if a second parent, which then ends up usually being a father, takes leave. So I think we could be creative and think about incentivizing leave taking in our policies, as well as in the way we implement policy on the ground.
Yeah. So we're coming close to our time, but there's two more questions that I want to hit on. And the first is transportation. In places without good mass transportation, workers are often facing a catch-22 between how you get a job, you need a car to get to the job, and being able to afford it. So what are the most innovative ideas or programs that you're aware of for this critical barrier to securing employment?
I'll just say that transportation is it is a tough nut to crack. I've been doing this since long before my hair turned gray. And I feel like there's been, and I've been on many panels, and I feel like our solutions around things like childcare and paid leave and unemployment and refundable tax credits and how to expand health coverage are far further down the field, actually, than transportation, which you might not think of as in that way. Certainly in places with mass transit, or in, there's just a lot more. There are a lot more policy levers to pull, right? Or in places with higher density, even if there's more levers to pull. And it's in those places that don't have mass transit for a reason, which is that things are very spread out, that coming up with affordable options is very difficult. In the end, I think in many of those communities, there's always small things, right? There's the rideshare van which are great community-based programs, and but they often aren't big system changes that, and I think a lot of times in those communities, the reality is that a car is really pretty essential to sort of how that community works. And so then the question is, like, how do you promote savings, or how do you help with financing? How do you get people banked? Because there might not be large scale solutions that are outside of that. But maybe Marla has the best option, and we'll just take it from there.
I do not have the best option, but I do have some thoughts, and certainly one of them that I think is really important for us not to underestimate is that our transportation system, the structures that define how and where, how people go places and where they go, was designed with a specific bias in many instances, right? And the design and layout of our cities, the presence of the whole entire highway system, right? All of those things had very specific ideas about who was to be kept in and who was to be kept out. And those things have been very effective, right? They've been incredibly successful at achieving exactly what they were intended to do, right? So I often hear people say like, well, you know, we have some unfortunate situations or whatever. And you know, I describe it as, this is not unfortunate, right? This was a choice, and this was a design feature, not a flaw at the time when a lot of these systems were developed. And so now overcoming them is incredibly difficult. One of the things that I am interested in, at least in the places where there are public transportation systems, is moving access to those public transportation systems into the traditional monetary system, right? So the notion that you need to have a special card or a special token or some other repository, that if you don't have it, then getting on the bus is really cumbersome, or getting on the train is prohibitive, you know, and you have to pay extra or whatever. You know, the use and acceptance of the regular card that you might present to buy your coffee and to buy, you know, your clothing and food and whatever else you buy, and also gets you access to transportation, I think is a game changer. In cities where that's been implemented, ridership and usage of public transportation skyrockets. And you realize how big a barrier it is, and also how much our transportation systems are spending on maintaining those alternative payments, systems, so that you can access the transportation, right? So, you know, that doesn't solve the bigger question, but I think all of those things play into what transportation was intended to do. And so as we think about how to change this, it requires addressing the fact that those biases have been calcified and integrated into our life, and overcoming that requires addressing some of those biases as well.
Marla, thanks for pulling out the design and the results of the inequities that we're experiencing right now. I think it's so important that we name this was intentional when it was designed. And there's a tax that happens on families in multiple ways, and I know we're out of time, but I really want to ask this last question. So we'll do that, and then we'll wrap up if that's okay with the panelists. So one person wrote, curious to hear the panelists' thoughts on the cognitive load and the mental health impacts of living in scarcity. They're really talking about toxic stress. How should we think about this when we're shaping policy and practice?
So I'd love to jump in. I have a theory that the experience of the pandemic and the constant risk balancing that that everyone is experiencing might be giving us a tiny taste of the mental load that scarcity and poverty and inequality and racism how that taxes people. I don't mean to say that those are equal or even, but I have thought a lot about how people describe this sort of mental load of this pandemic time, people that are of means, that where it's not scarcity that is affecting them. And I've wondered a lot about whether that could make us have more empathy. I think the research is really clear that poverty, inequality, racism, that these pieces have this impact on people, that the stress of worrying about whether you're going to be evicted, worrying about whether you can put food on the table, and all the machinations, right? I'm going to pay this bill because otherwise there's going to be this consequence, and I'll wait on this one, and next week I'll fill in this piece and I'll wait on this other piece. All of that is mental energy that isn't going into other things, right? And so what I think is really critical about that is to take a step back from all the individual policies we've talked about here and many more that we haven't talked about, and ask ourselves, how different would it be for families if we had public and private supports in place that created substantially more economic and health security? That people are going to have ups and downs, and they're going to be tough times. But if we had a base of supports, whether it's through a fully refundable child tax credit, better unemployment insurance, you piece it together and you can make the pieces fit different ways. But if we ultimately had a structure that said, there is a baseline of economic security and of health security that we are going to assure for U.S. households, How different would that be? Well, it would mean that kids wouldn't be constant, that there wouldn't be groups of kids that were constantly facing the threat of eviction or moving from house to house and therefore school to school, and all of that happens to poor kids and is part of why their educational trajectories are shortchanged, right? You think about all the ways it could transform families if there was a better baseline of basic security, and what that would do not only for children's trajectories, where I think the research is quite clear, but what it would do for adults, what it would do for an adult's ability to make good decisions, to not have all of that mental balancing, to think about ways to move forward. So really appreciate that question, and think it is ultimately one of the fundamental questions about what is our policy structure intending to create for families.
Thank you. And thank you to all of our panelists. I want to thank the audience for participating in this last session of WorkRise. As we mentioned, it was recorded, so please share with your colleagues after, and I want to thank everyone and tell you to have a great weekend.